All right, let's talk about something that almost everyone can relate to at some point in their lives: low back pain. You know the feeling? It's frustrating, it's super common, and honestly, it can be a total mystery.
What is actually going on in there when you get that ache? Is it a muscle, a disc, or, is it something more serious? That question alone can cause a whole lot of anxiety. Well, today, we're going to pull back the curtain and demystify it.
And the best way to do that is to follow the story of one specific patient. By seeing this whole process through their eyes, we can really understand how doctors tackle this incredibly common problem and what it all means for you and me. So let's dive in.
Okay, first things first, let's meet the person at the center of our story. And look, this isn't some bizarre, rare case from a textbook. This is a situation that could literally happen to any one of us.
So here's the rundown. We've got a 48-year-old guy, works a desk job, so he's sitting a lot. For the last 3 weeks, he's had this nagging, dull ache deep in his lower back. And it's a classic story. It gets worse when he's stuck at his desk for a long time, but it feels a little better when he gets up and moves around. Now, this next part is absolutely crucial. He isn't feeling certain things. No sharp shooting pains down his legs, no weakness, no numbness. These are super important clues, as we're about to find out.
So, the investigation begins. And you should really think of a doctor in this situation like a medical detective. They've got a set of clues, the symptoms, and their job is to figure out the cause by systematically ruling out possibilities, one by one. And what's the first thing any good detective does? They line up the usual suspects, right? Well, in medicine, we call this a differential diagnosis. It's basically a list of all the potential culprits that could be causing the symptoms. And this table right here, it's the perfect lineup of suspects. The detective, the doctor, always starts with the most likely culprit. You can see it right at the top. Mechanical pain, like a simple muscle strain. That's your very common one. Then they think about other possibilities, like a degenerative issue, maybe a prolapsed disc. It's only after considering those that they move way down the list to the really rare stuff, like infections or, heaven forbid, tumors. You always start with the simplest, most common explanation first.
So, how do they narrow it down from that big list? Well, it's a pretty straightforward 4-step investigation. First, they get the full story. When did it start? What exactly does it feel like? Second, they specifically check for any signs of nerve trouble. That's the radiating pain, weakness, and numbness we talked about. Third, they look for clues of a bigger body-wide problem, things like fever or losing weight without trying. And finally, the physical exam, where they actually watch you move and do specific tests to check for things like a pinched nerve.
Okay, now we get to one of the most critical parts of this whole investigation. It's the active search for something called red flags. This is where the detective work gets really serious, because it's all about making absolutely sure nothing dangerous is being missed. So what in the world is a red flag? Well, to put it simply, it's a warning sign. It's a symptom or a finding that tells the doctor, whoa, hold on a second. This might not be a simple muscle strain. We need to look deeper, and we might need to do it right now. And for back pain, these are some of the big ones. You see things like unexplained weight loss or a fever, which could point to a hidden infection or something else going on in the body. But the ones that are a real emergency, the ones that get a doctor's attention immediately, are signs of serious nerve compression, like losing control of your bladder or having major weakness in your legs. These are the kinds of symptoms that tell a doctor an MRI might be needed, and fast. And for our patient, well, here's the great news. After going through that whole checklist, the doctor found 0 red flags. Not a single one. And that is incredibly reassuring. It means all those scary, rare causes way down on that list are extremely unlikely. So, with all the serious stuff ruled out, our medical detective can now confidently name the culprit and, more importantly, lay out a clear plan of action. And the diagnosis is mechanical low back pain. I know, it sounds a little technical, but it's actually the best news you can get. It's the official name for that really common, non-specific pain that just comes from the structures of the back. It's what's called a diagnosis of exclusion. Once you've ruled out all the red flags, this is what you're left with. And it's the best diagnosis to get because it's not dangerous and it gets better. Now listen up, because this is where the advice has done a complete 180 over the years. The single most important thing to do is to stay active. The old idea of just lying in bed, turns out that's one of the worst things you can do. We now know that gentle movement keeps blood flowing to the area, which helps with healing. It also stops all your supporting muscles from getting weak and stiff. Just trying to continue your normal life as much as you can is key.
Inactivity, and especially fearing movement, can actually make things a whole lot worse. The long-term game plan is all about playing defense, making sure this doesn't happen again. And it's usually about simple changes: getting a supportive office chair to improve your ergonomics, doing regular stretches to build up your core strength, and learning how to lift things properly. All these things can make a huge difference in keeping that pain from coming back. So, when you put it all together, the full plan looks like this. It starts with education and reassurance. Just knowing what's going on is a massive relief. For the pain itself, a short course of anti-inflammatories can really help. A physical therapist can give you a personalized exercise program. And finally, you plan to check back in a few weeks, just to make sure everything's on the right track. So, we've followed this one person's journey from that first ache to a full-blown action plan. But what can the rest of us learn from it? Let's zoom out and look at the big lessons for managing our own back health. Okay, here are the 4 big takeaways from all this. Number 1, please remember, the vast majority of back pain is not dangerous. 2, understand that those red flags are what really drive the decision to get a scan, not just the pain itself. 3, and this one is a game changer: movement is medicine, bed rest is not. And finally, prevention through good posture and core exercises is hands down the most powerful tool you have. And that really brings us to the final and most important thought of all. While it's awesome to understand how doctors think about back pain, the real power is actually in your hands. More than any pill or therapy, it's the small choices you make every single day: how you sit, how you move, how you stay strong, that are truly your back's best medicine. I hope this was helpful, and thanks for joining me.